Sutton. This is Road to Recovery. I'm a person in long-term recovery. And my special guest today is Katie Walker. Katie has an amazing story. Uh, she's an example that recovery is still possible, even during a pandemic. Uh, she's used Montgomery County services to get where she is today. And welcome, Katie.
Thank you. Thank you for having me.
So, can you tell us a little bit about the beginning of your story? How did you uh, come into the need for recovery?
Sure. My story is, I think the primary theme in my story is denial and acceptance. When I think about the big picture, started drinking at a young age as a teenager, kind of trying to deal with low self-esteem. The alcohol gave me the liquid courage to be outgoing and just come out of myself. So I did that for many years, and it was actually, not problematic until later, probably early adulthood into my 20s, where it did become problematic. I still thought it was fun, believe it or not, when I was the girl at the party who fell asleep in the bathroom or danced on the table at the company picnic, or was belligerently arguing with people about the need to drive because I was the only one that could drive, even though I certainly shouldn't have been. But those were not cues for me that made me believe that I had a problem. It's just, it was a solution, of course, at the time. So that continued on until after I got married. I had two children. And after my second daughter, I was a single mom, and although I was successful employment wise, there was really nothing else going on in my life other than my kids. I focused on my kids because I always wanted kids, and so I wanted to be a great mom, but I also didn't want to be a single mom because I grew up with one, and I knew the challenges of that and the results of where that brought me as an adult. So I think that may have led a little bit into some depression, but the alcohol and also then the abuse of sleeping pills and anti-anxiety medication that were legal most of the time. I think that worsened my condition, my mental health condition. So I'm not sure which came first, the depression or the substance use disorder, but I know that they both play on one another, and mine just heightened to places I never knew it could go. I started off just kind of neglecting work a little bit and neglecting myself. I worked from home, so this was actually way before COVID, and so I had not a lot, no social life. Didn't take my kids anywhere. We were just home, and I would work, and that was all I would do. And I thought I was fine, so I still paid the bills, still had a home, but then I also began to neglect my children, which resulted in loss of custody. So my family intervened and took my children away, and after that, everything went completely downhill. I'm sure that the goal of taking the kids away was to give me an opportunity to get better, but my addiction took off, and so I drank, and I took whatever kind of sleeping medication or any kind of escape I could get. I took to heights where I just kind of like to summarize as bad as it got, where of course losing my children was ultimately the worst thing, but it was just the first thing in the events that occurred, because I then started getting DUIs. Over my history, I've been charged with a total of seven DUIs, where as I think my higher power would have it, I've only actually been convicted of three of them. So go figure. Still some grace there in the fact that I probably should have gotten in trouble for all of them. But so those seven DUIs, I have lost, gotten and lost more. I was 15 jobs is actually the count, and it's truly a count that I had to write down while I've been in treatment places, where I took an account of, all of the things that had happened throughout the scheme of things. And I mean, these were jobs that paid six figures, that offered benefits and stability and opportunities for growth. So these weren't just, your everyday hop around jobs. These are ones that when I lost them, they crushed me. Um, as well as cars. I had luxury cars that I wrecked or that I lost because I lost my job. And I had um, I actually had, a couple of homes that were really nice. All of that over a 5 or 6 year period of time, I lost. And I still didn't think I had a problem. That's the part that's so funny about the denial. I still didn't think I had a problem. I thought I was depressed and that I was self-medicating because I was depressed. At that point, my kids were taken, so I had a reason to be depressed. And so things stabilized because again, I've been extended grace just countless times within my life. And so in 2019, I got yet another job, another six-figure paying job at a corporate office. I bought my dream car in January of that year. And then in February, I decided that because I didn't have a problem, I could go out with my coworkers and drink. Even though that's the primary source of why I lost everything that I lost. And so I did that. And then I ended up on the parking lot of my job. I got a DUI in the parking lot of my job. So on that day, I lost my job, my car, my home, my family. I lost everything on that day. So 3 days after, it took me 3 days actually to roam around on the streets and beg for money to drink, to continue to drink. I slept in little fast food dining restaurants as much as they would let me. And it was freezing outside. It was terrible. It was terrible 3 days. And then I decided to go to the hospital because I figured, I could get to at least some warmth and food, and made up excuses about why to stay. But they knew I was just there because I was intoxicated. So before they were trying to discharge me, I decided to ask for help. And so that moment is why I'm where I am today.
Wow, that's great. That's a fantastic and moving story, and I can identify with it being a person in recovery. I've heard similar, what we call war stories in the rooms. Now, but I'm glad that you did go to the hospital because fortunately for Montgomery County, we have what's called a steer team. And that's when you met the steer team, and that's when you entered the road to recovery. So, who was your who was on the steer team? Who came and got you?
So the gentleman that came to the hospital, his name was Alex. I don't think he's with the team anymore, but he was there for a good portion of the beginning. But he came into the hospital room, talked to me. It was so foreign to me. I had no idea this kind of help existed. No idea. And so not only did he come in and talk to me, and he was comforting because he was a peer, he had his own problems. Of course, he didn't look like anybody who'd had problems before. But he immediately started, searching for next steps for me. So I mean, it took off from there, from him just coming to have a conversation with me and me deciding that I wanted help. I mean, of course, that was a big part of it, but from that point, he searched around in the county for places where I could go into treatment. Grace, again, I believe, is how I ended up with being able to go into a spot the next day, but still had to discharge from the hospital because they didn't have a reason to keep me. So he actually also hooked me up with someone at the Montgomery County Crisis Center, where they put me into a shelter for the night, and then the next day they got me a ride over to the treatment center, where I ended up staying for 3.5 months. So all thanks to Steer.
Okay, so let me ask you this: did you have to take a COVID test before you went to treatment or before you went to the shelter?
So when I entered treatment, it was literally 2 weeks before shutdown. So
okay.
Prior to, but what it did affect was when I got into treatment, we stopped being able to leave out of the building to go to meetings. We stopped being able to have visitation, so I could not have video or family visit the entire time that I was there. So that was a struggle. And then that 2 weeks when shutdown occurred, they stopped taking new patients. And so we were all quarantined in the treatment center. People who were scheduled to leave couldn't leave. Um, it was it was it was a unique situation. It was very tough. There were a few days, especially at the beginning, where we didn't. I think even the staff didn't really know what to do, because it was all so different and new. But then they did begin to reopen and take patients in. But what they did was they had to limit the number of people they could bring in, have them go on to a quarantine wing, if you will, in the facility, and they had to stay in their section while the rest of us were in the rest of the building, and even the cafeteria. Like, they had to stay in this one area for 2 weeks, and that was at the beginning, where there were no tests, so they had to be there for the whole 2 weeks before they could come out into the population with the rest of us. And then, of course, as time went on, and just before I left, they got some of the tests in hand, and so people would come in, not very many at a time. They couldn't help the people they wanted to help, because they just couldn't bring them in and keep everybody safe. So yeah, I did not have to quarantine or take the test myself, but I definitely witnessed a lot of people who had to do that, who wanted help, and some couldn't get in for help because of.
Wow. So you just barely got in before that shutdown. Wow, you were fortunate. Like you said, you really riding on grace to
Yeah,
come in, because you were in Avery Road,
I was in Avery, yes.
right? Because I believe once the numbers started going up of infections in Montgomery County, Avery Road had to switch to not only limiting the number of people coming in, but they started taking men one week and women another week as a way to manage, the quarantines and the infections and the staff infections too, to keep the staff from becoming infected.
Exactly right. And and it was 2 weeks, of course, that they had to stay in there before testing came out. So there'd be men for a week, or for 2 weeks, then women. And sometimes those people in quarantine would leave because they couldn't stand the isolation. So yeah, they did what they could. They did the best they could to try to still help people, but it was
Right.
really
So,
wanted.
so let me ask you this. We got a couple of minutes before we take a little commercial break, but I'd like to ask you now, when all of that uncertainty and fear and you know uh, anxiety and stress from being in a treatment center, not being able to see your family, did you want to drink?
I absolutely did. There were days where I wanted to leave, and which leaving meant that they were going to have to report you to whatever authority it was that was making you a risk to the public. But there were times, because I mean, yeah, there was so much instability. There was a lot of support there, of course, too, but even the support people were strained. Like, they were having to stay there overnight and working every shift, and so it was rough. It was rough. I really, really had to want to be there. And so did the other people that stayed.
Right. Yeah, and my hat goes off to you because again, I'm working in the jail and I see the stress on the staff as well as the fear in the inmates because they might get infected and then they're worried about their families that they can't talk to. So
Yes.
I'm sure you're concerned that your girls could get infected while you're in the treatment. So I'm sure that was a great challenge for you to weather that storm. So I
Or
think we're going to take a commercial break right here. This is James Sutton with Road to Recovery. My guest today is Katie Walker, and we'll be right back.
Our fight against coronavirus isn't over. Let's wear face masks in public, stay 6 feet or more from others, follow state and local guidelines, and wash our hands frequently. Let's move forward together. Learn more at coronavirus.gov.
Hi, I'm James Sutton. We're back with Katie Walker. So Katie, you were telling us about your experiences at Avery Road. And again, I really congratulate you on your willingness to stay the course. Even though it was uncomfortable, even though you were stressed and worried about your children, you still stayed for your recovery, made your recovery first. And consequently, you have a lot of rewards to share with us. So again, we have spoken about the steer team's effort to get you from the hospital to the shelter to Avery Road. Uh, also, from Avery Road, you went to a program called Lawrence Court.
That's correct. I went to Lawrence Court. It's a halfway house for basically the reintegration through from recovery back into normal society, if you will. And Avery Road also they set me up with an IOP through Journeys. So all of these things were arranged from with my discharge at Avery Road. And I think it's important to say all of these things were covered by Medicaid because, of course, I lost my job and so I had no income, and it took care of everything. So I didn't have to worry about those things, and that was really important because any previous attempts I've ever made, even though I didn't believe I had an addiction issue, there were times where, especially for the courts and things like that, that I had to go to an IOP or I had to go to treatment. I had to, see psychiatrists. It was always something that I wanted to do really quickly because I had to get back to work. And so this time, because I didn't have to, and honestly, I guess it's an unfortunate benefit of COVID for me, was because I couldn't go right back to work. So more grace, I believe, as far as my individual situation, where even if I had wanted to go back to work, I couldn't. I was set down to get it right.
Yeah, so that's right. God made you sit down and pay attention, right? Now, from Lawrence Court, you also you made the connection with Tree of Hope. You made a connection with with a 12-step community. Can you share some more of the supports that helped you get to? I went to your celebration fantastic celebration where you celebrate a year clean.
Yes.
And can you name some of the other supports that you got from the community, like Tree of Hope, or I understand a businessman from the Montgomery County gave you a job. Somebody else gave you a car.
Yes, absolutely. All of that was from the recovery community. So I went to Lawrence Court. I had actually heard about Tree of Hope while I was in treatment because they would come into via Zoom because of COVID. They came in via Zoom and they had speakers, or they actually had like a talent show at one point too. So we did still have some introduction to Tree of Hope there, but they offered a service where they could actually assign a peer to you individually. So after learning about that, and while I was at Lawrence Court, or actually it was before I went to Lawrence Court, at Avery Road, I requested a peer and I was assigned a peer who worked with me to kind of establish some goals and, just be a support. Offered resources as far as not only resources, for whether it was finances or connections, but for some 12-step meetings and things like that as well. It was also provided just as, so I didn't have to search for it. It was kind of given to me. So I continued that relationship with my peer while I was at Lawrence Court. But then I also learned that Tree of Hope offered classes for recovery coaches. And so I started enrolling for the classes. They offered scholarships for people who weren't working, so more grace. And so not only did taking those recovery coach classes position me to be where I could consider, being a recovery coach as a career, it helped me with my recovery because of all of the things that I learned. I learned about all of the different pathways to recovery. I learned about just all of the resources that being connected can, help you to pass along. And it's just seeing also with Tree of Hope and how they do connect with all of the other organizations and resources within the state, outside of the state, just doing so much good work in recovery to make it available, that help available to people has been amazing. And so not only that, with Tree of Hope, I then started working with the co-director as her administrative assistant, volunteering, still doing that as of today. She introduced me to someone who's on the board at Tree of Hope, who then also gave me a job working at his accounting firm. On grace and on her word and on mine, knowing my true history, gave me a job right out of gate. Also through those classes, met another peer in recovery who handed me a car, gave me a free car, free and clear, no money down, nothing, just gave it to me. So all of those things occurring. And then even while I was working for that employer, I then also got offered another job, the job that I'm working right now, which is back in my field. And that I think is one of the ultimate blessings and gifts, is that I didn't think I was going to be able to come back into my line of work, because, I've burned bridges, and I'm sure people talk, and it's, 15 jobs in the last handful of years is very hard to have a reference. So, it was definitely not something that happened here that was not supernatural that got me where I'm at today.
Right. Thank you for sharing your continuum of care and some of the community resources, because recovery is not just a one person, effort. It takes a whole community. The whole community should be embracing us as we enter recovery. We need a family support, we need professional support, we need peer support. So it's a team effort, and it sounds like the team did a great job with you, and you're definitely a success. And what about your family? How's your family relationship now that you're in recovery?
So I get chills when you say family, because before, last year, every time you said family, I would cry. Today, I want to cry, but it's joy. I'm so close to my children. It's everything I ever dreamed about before all this happened. Like this, I'm the mom. I'm getting to be the mom that I wanted to be, that I've always wanted to be. My children believe that they see a strength in me that they want to mimic. They want to be like me, if there's nothing else, but sticking and staying, and keep getting up when you fall. So our relationship's amazing. My sister and she's getting married this weekend. I'm giving her away. Like it's unbelievable how far these relationships have come, and how much love and support they are offering. Not that they wouldn't have offered it before, but I may not have accepted it before until I came out of that denial of all of the things that I was denying. And that was so yeah, it is ultimately just wonderful. And of course we have bad times, but they're just different. My outlook has changed by learning, especially in the 12-step program that I've made my home in. Just the principles that you're taught about life and about being a better person completely has changed who I am, changed my family, it's changed my children, it's changed the dynamic of everything that I touch. And it's just amazing.
So your sister had your children, so the children are back with you now?
My children, my oldest child is 20, so she's in college. Even though she does live here, but yeah, I have my youngest daughter is back in my custody. So
great.
So yeah.
And now that you've celebrated your year, how do you maintain what you learned at Avery Road and at Lawrence Court? How do you maintain your recovery?
I'm totally in love with with the 12-step program that I've chosen, which is NA. I have a home group. I have an amazing sponsor and grand sponsor, and just a whole sisterhood of other people within that fellowship. I continue to volunteer for Tree of Hope as well, and it's fulfilling, and it keeps me grounded. I also have individually, we go out, and my family and we have family therapy. We are also spiritual family, so we attend church services and things of that nature. And I think all of those combined are helping me to stay clean and stay in the recovery mindset.
Right. Yeah. That's great. Yeah, the same thing for me. I found what works early on in recovery will always work. Once you what we say in the fellowship is, once you get the basics, you want to stay with them. Whatever works for you works for you. So just because it works, don't leave it and think that you're cured because it worked. You're doing well because you're doing what's prescribed for a person with the disease of addiction. So, wonderful example of recovery during COVID. For those that are not in recovery yet, is there anything you want to share about your denial or your interpretation, your fear about what recovery was going to be like? Is it like how you imagined?
Boy, that is a wonderful question. Not at all. All that I ever thought about recovery in any of the recovery programs is that you were going to go and you're going to be talking about how to stop using drugs or drinking alcohol. Had no idea that that it almost has nothing to do with that. I mean, that's the first thing you do is you stop using, and you do need to try to continue to do that so that everything works out. But it is nothing like what I thought it would look like. I was, I thought that I was so smart that I knew that all you have to do is stop drinking. Well, that's not the only thing. You do have to work on yourself, and these programs and other pathways position you to do that. They position you to do that with a group of individuals who are trying to do the same thing. So you find a whole new community of people who are just trying to make themselves better and help other people too. It's a big principle of the programs is helping other people. So it's amazing.
And that's an important point too. I want to underline that point. Uh, so how does helping others help me? How does that work?
Oh boy. First of all, it gets you outside of yourself, so you can stop being so concerned about what's going on in your world. But it truly gives you purpose. It reminds you, kind of what I think of what the design for humanity is. Like we weren't designed to be here alone. And so when you start connecting with people, you start to just feel a comfort and a serenity and a peace and a hope that you never knew existed. It sounds like cliche and, and like magic. It honestly is. Like it really is. I hate to say it because it sounds so fruity and fake, but it's true. It really is true. It's that simple.
Okay, we got about a minute left. Anything you want to leave? Any statements you want to leave the audience with as we close? We got about a minute left.
Sure. The only thing I would say, just as far as especially trying to do recovery in COVID, is ju- instead of looking at it as a deficit, I would encourage people to look at it as a benefit, because if nothing else, one of the other things that I saw about recovery that was not attractive to me was having to spend an hour and a half or 2 hours going back and forth to meetings. That's no longer an excuse for me, because now all you have to do is tap into a meeting. You can be on a meeting 24 hours a day, at least with 12-step programs, and certainly the other pathways as well. It's more available to you now than ever. Some of that human touch is missing, but I think it'll come back. But don't give up on it just because it's different. It actually works. It actually
Thank,
works.
thank you so much, Katie. So this has been Katie Walker with a fantastic story about how she covered during the pandemic using Montgomery County services. So if you or anyone, your family members or anyone you know that needs services in Montgomery County, access to behavioral health, the number is 240-777-1770, or you can call the 311 in Montgomery County for, for help. This has been Road to Recovery. My name is James Sutton, and I'll see you on the road to recovery.